Welcome to Inside Aesthetics, the world's leading podcast for injectors and cosmetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor based in Sydney, and I'm joined by my co-host and good friend David Segal, an entrepreneur and an aesthetic business mentor. Each episode of IA showcases unfiltered conversations with guests from around the world. In a sometimes disjointed industry, IA aims to help educate and connect our global community to raise the bar for both our businesses and our patients.
To further support and educate our listeners, we offer a range of additional resources under our IA Patreon subscription service. This caters for injectors and business owners of all levels and includes interactive live Zoom sessions, webinars, hints and tip videos, private chat groups, and exciting future content to come. To subscribe to IA Patreon, head to www.insideaesthetics.com/Patreon or click the link in our podcast description. You should seek medical advice before undergoing any treatment or procedure, and these podcasts do not replace a professional and bespoke consultation.
Good morning, buddy. We're back again.
It's Podcast Wednesday. Got a double dose of Jewel and Julie today.
Yes, we're very excited. We've been trying to tee this. I don't know how long it's been since we've been loosely talking, Julie, but it feels like a long time. But thank you for joining us. Now, first of all, we've been seeing on Instagram that your husband's not been well. So give us the update. I heard there's some happy news and he's home now.
Yes. They found some tumors on his kidney. They took it out with a robot. And didn't have to remove his whole kidney. So I'm happy about that. And we're just waiting for pathology and see what the next steps are.
Awesome.
But it does look like they caught it early enough. So I think we're going to be in the clear in a week.
Fantastic. Excellent. Well, yeah, I was glad to see that you came home. How's your week been, buddy? Have you been busy?
Yes, I have been. Don't ask me what I've been doing. Because every day feels the same, to be honest with you. I can't even differentiate the weekends from the weekdays anymore because they're kind of much of a muchness, to be honest. It's admin, emails, podcast stuff, family stuff.
Webinar this week as well?
I don't know. It's good though. It's busy, but I can't believe it's September.
I know. It's crazy.
It's mental. But you know what's interesting is that we're coming to you, well, not live, but recorded from Julie's cupboard. We're looking at all the amazing. So anyone that's watching this, well, there'll be some YouTube clips of this in the future. But we're looking at, I said to Jake, I mean, maybe I'm showing my age here, but I thought we were in like Imelda Marcos's cupboard. She's the former Prime Minister of the Philippines who was known for a shoe fetish.
Well, there's a skull in this cupboard as well.
I totally remember her. I think maybe I modeled her as a kid, you know.
Yes.
I'd like to know how many she had, and then I'll count mine, and then we'll compare illnesses.
Do you wear all those shoes? Or do you have them on rotation? Like, how do you get through them all?
I have worn every single one of these shoes. That I love shoes. They're the one thing, no matter how much you weigh, they're going to fit. So, and my weight has gone up and down 30 pounds up and 30 pounds down my whole life. So that's why I just save my shoes. They're fun, right?
Yeah.
Fantastic.
And I dress my clothes to match my shoes, of course.
Right. So how many do you think you have? You haven't counted them before?
God, no, I haven't. No.
There's a ton, guys. That Julie gave. It's not just a cupboard. It sort of branches out into different wings.
It's a whole wing of it. Yeah. Wow.
It's a whole vibe.
That's awesome.
I love it in here. But this is a one room that the dogs don't come and whine and get on me. I love my dogs, but they can be annoying in the middle of a live or a podcast.
Fair enough. So look, Julia, I'd like to introduce you properly.
Yes.
We sort of did that very casually. So, probably one of the best known nurse injectors around. You've got a massive Instagram account. You've been injecting since, I think, 2001. Tons of experience, but introduce yourself to our listeners who maybe are new to sort of your profile and tell us all about you.
Oh, great. Well, I'm a small town girl. I'm a truck driver's daughter. I really just have been addicted to people my entire life. People are my drug of choice, So I feel like I started out in medicine as a surgical technologist, handing instruments and surgery, which was a lot of fun. I learned a lot of anatomy. That was great, but I didn't really have any patient connection. So when I think it was 1998, I noticed that laser hair removal came out, and it was exciting to me. So, and I had like literally a little goatee. So I had a lot of, that's my inspiration for starting the company is I was like, I can't be the only one with chin hair. So anyway, I pitched the idea to my brand new husband. We just got married and he loved the idea and we wanted to have kids. So I thought, hey, this is a flexible job. You know, the OR is not very flexible. So I thought this would be a good business to start. So I literally entered nursing school that year, got married that year, 1999. It was a huge year for me because I got married. I got pregnant with my first son. I started the business and it was just, and I started nursing school. So it was absolutely exciting and incredible, but really pretty scary because you know, back then, laser was something Austin Power talked about with sharks on their freaking laser beam heads, right? So people were afraid of laser back then. And so it was, you know, my business was very slow getting started. And that was okay because I was in nursing school and I was pregnant. But yeah, I remember I hired a nurse friend of mine to do it until I graduated. And then I finally graduated and it was, again, very slow. I think it was about 5 years before we ever saw any black. We were in the red for the first 5 years for sure. Mm-hmm. But, you know, I did it. And then, I don't know, I just think this field of medicine is super exciting because it's always changing. And looking back at the start and how I did it, I think I was pretty lucky in that I got to learn one thing at a time, right? Laser hair removal, then tattoo removal, then collagen, injecting collagen, which nobody does anymore.
It's coming back.
It lasted about 10 minutes.
The trend's coming
right?
back. Yeah.
And then I was so excited when Restylane came out because 2004, I finally felt like I was good enough at collagen and wanted to start that. Oh my gosh, game changer. Yeah. And started with lips and nasolabial folds, which now we know is a very dangerous place. So my why is people. The patients really, really inspire me and just lift me up. And now I'm not seeing patients anymore. I'm only teaching full time. So I feel like my team is my primary source, and my Patreon subscribers and people that I teach through Allergan or Galderma, Palette. Those people are now, you know, feeding my drug addiction, which is people. So it's just fun, you know. I just love my career.
Yeah. I know we normally leave business questions to later on in the discussion, but I'm going to invert that today because you started talking about being in the red for quite a period of time. And 5 years is quite a long time not to be making money out of a business.
Good thing I was married to a surgeon.
Yeah, right? So there's a lot of
people. So it's funny. He supported me. He supported me very early on for years, and now I'm supporting him because he's retired. So it's fair.
There you go,
We're balancing it out.
So there's a lot of people listening to this who are starting their own businesses or early stages of their own clinics, and it's a question that comes up a lot. I do a lot of consulting work for nurses and doctors on the business side of things, and it's a conversation that comes up is how to mentally overcome the stress and the anxiety of starting a business, waiting for it to become profitable. You know, you said you were lucky enough to be married to someone that was able to support you. But how do you sort of mentally go through that? How do you have, especially back then, have the courage and the foresight to believe that this is eventually going to turn and this is going to become a career that's going to be sustainable and provide you with an income to provide for your family? Because it is stressful.
Right. And I think it's probably a whole lot different now. Because the advantages of starting your business now are that it's mainstream, that everybody's talking about it. It's not taboo. It's not somebody's dirty little secret, right? So that's different and exciting. But I think the disadvantages for somebody starting now is that they have quite a saturated market. It seems like Starbucks now, right? There's this medical spa in every corner. However, there are plenty of wrinkles to go around.
Yeah.
And, you know, if you set yourself off aside, if you kind of set yourself apart from other people by saying exactly who you are from the beginning, you will attract those patients that gel with you. And I think learning how to retain patients, it goes really, really, really far. And I did joke about being supported by my husband, but it was a different time, I think starting out now, I would use social media to show how serious I am about this field. And I would show my personality so that I would draw people that we would be a mutual benefit to each other.
Yeah.
I don't want to draw people that don't respect or value what I could do for them, right? I think a lot of people make that mistake in the beginning. They'll do discounts. They'll sell syringes or units instead of what they can do. I think that's a huge mistake. So yeah, that's how I would advise them is be yourself, don't discount yourself, and plunge every bit of yourself into the business. I always say, don't read novels anymore. Just listen to them as you're going to sleep. Just read journals, read anything you can get your hands on from respected sources and learn from respected colleagues. And just really, really dive into it and you'll be successful.
That's a really good point about being yourself, because when I look at social media, it's a sea of sameness a lot of the time. Like, I can't often tell one person's account from another because you're seeing the same kind of imagery, the same kind of content. And I don't know whether that's people being afraid to be themselves because they're worried that they're going to alienate themselves and not understanding the concept of attracting patients that suit your personality, suit what you deem as appropriate treatment outcomes, the aesthetic that you're trying to create. And so do you have any advice for people on, I guess, finding the courage to sort of put themselves out there and be themselves? Because that's something that you've done quite well. Like, I think you're obviously a very skilled injector, you know what you're talking about. But what has probably drawn people to you initially is who you are, the way you sort of come across, attracting people that vibe with your energy and the sort of things that you say and what you stand for. So how would you sort of, if you're advising your daughter or someone that came to you as a mentee and said, hey, Julie, tell me how to find myself. How do I find that point of difference that will separate me from all the other injectors out there? Because clinical outcomes, I think, are just an expectation. Like, when you go to, a lawyer or an accountant, you expect they're going to be able to do, your legal or your accounting work, but it's going to be how you connect with that professional and do they understand you and are you on the same page? So, yeah, long-winded question, but how would you advise people to find that courage and to find their voice?
It's funny because I just had this conversation with my son. Yeah. He's 21 and he wants to go into this field of medicine. He's a senior in his undergrad right now. And just like me, he is naturally born shy. So I think, and I was very painfully shy until I was about 31. So it's something that's harder, I think, for shy people, or people that constantly in their head have what do other people think going around and they're swirling around in their head, and that's how I used to be for years. I mean, in 31, I finally got my S together and got some confidence. And I think my husband is the reason that happened for me. So I'm trying to get that instilled into my son's head now, while he's 21, right? I want him to be 10 years ahead of me on this one, because I didn't really get together with his dad till I was 31, or I like to say 30 wonderful. So, so he's 20 wonderful, and I think he's getting it. I think he's finally grabbing that confidence. And I just say, hey, you know what? When you're on social media, when you're on your YouTube, just pretend that screen is your best friend and behave and say things that you would say to your best friend. Because you can be yourself around your best friend, right? You just can. They're going to love you no matter what. So you have to sort of pretend, like I'm pretending right now, that everybody that listens to this or watches it is my best friend. Because if I start getting in that circular thinking of haters or of jealous people or people that don't believe a nurse or a nurse practitioner should be injecting. If I start getting in that cycle, I'm not going to be myself. And I'm going to be very self-conscious, and I won't say, squeeze out an F word once in a while. I'm just not going to be myself,
Yeah.
But that's who I am. And if they don't like who you are, then fine. You don't want to attract those people anyway. And you don't want them in your office. You don't want to inject people that don't like the true you. And I hate that. I hate when people say, oh, Julie, I'm too old to be in this business. I'm too short. My hair is not like everybody else's. Well, just like you said, do you want to be in a sea of sameness, or do you want to let your hair be what you want your hair to be, or, not be? But that's not the important thing. I think standing out by being yourself is brilliant.
Yeah, it's good advice. I have to say, I think we've taken that own advice on our own journey of the podcast. We started not knowing what we were going to put out and who's listening, and we had no freaking idea. And I felt like we would constantly sort of seek affirmation by asking people and doing surveys. What do you want to hear, and what do you think's working? And then we sort of found our groove, and we just realized we should just do what we're doing because it's working.
Yeah. If we enjoy the conversations and we're interested in the people we're talking to, then hopefully we'll attract people that feel the same way, rather than trying to, appease. Because you're never going to make everyone happy, right? Because you're just going to end up getting exhausted from acting all the time, because it's not sustainable. And then, as you said, you're attracting people that maybe you don't like. They don't really like you. And that's fine. Yeah.
Yeah. And I have to say, and I don't think we've ever said this on the podcast, we've had one or two that irritated people. Not lots of people, but a minority of people got irritated by one or two of our podcasts. And I think we have the conviction to go with it, to believe in what we're doing, and just, we can't please everyone. And that's what you're saying. You can't please everyone, but if you put out your own energy, you will find your tribe. I think that's what you're saying, Julie.
Yeah. And I think speaking your truth and having the courage to speak your truth, even if your truth isn't really very popular with other people, just pick any debate, right? Whether you aspirate with a stationary needle or move it back and forth. But that's the,
I was going to bring
newest
that
one today, right? Yeah. I said my piece, and if somebody is nasty to me, then, oh, well, it shouldn't be, they shouldn't get their emotions up. Should be a very professional, thoughtful discussion, rather than, getting your hackles up and, I don't know. I'm too old to let my curly hair stand on end. So I'm just not going to play any games, but I'm just going to say what I think. And I think that I want to listen to what other people think, because we all learn when we are having discussions together, but we certainly don't need to be mean about it and snarky about it. And, we shouldn't be biting back like a little chihuahua,
Well, it's a good point, actually. And we're referencing yesterday's post by Professor Sebastian Cotofana. So this will be out in a few weeks. So it'll be old history by then. But I guess it's good to get into this. Like, if you stick your neck out on social media with whatever thought that you have, and you've got a big account, Julie, you're going to get some trolls. You're going to get some hate. You're going to get those snappy chihuahuas. So how do you deal with that? Because it's very hard to not sometimes take it personally.
Yeah.
Even though that what you're saying is from, it's probably true and it's from a good place. You always get that negativity. So what do you think is appropriate to talk about on social media, and maybe what's not? Because I think that we're in a place now where just everything is dumped on social media, and maybe some of it shouldn't be there. Particularly these sort of really academic questions and debates. I know it's good to debate and stimulate that argument, but sometimes it just gets out of hand and just polarizes. So that's one reason why we do this podcast, to actually have a proper in-depth talk without all of that noise and the keyboard warriors. But what do you think? Like, how do you handle with the negativity, and what do you think is appropriate to actually talk about?
Well, I usually, if I don't know them, it's a clear troll account. I just, restrict and delete and move on, block them if they're really nasty, because I don't want them around. It's just like a little buzzy gnat. They're annoying, and you just don't want to be around it. And it's probably somebody with a really terrible life, I say a little silent prayer for them and move on,
or a competitor.
They probably need a hug.
Yeah.
They probably need a lot, right? They need something. But if their need is to keyboard courage, bully me, then they can, they could be restricted and blocked and say la blah blah.
Yeah.
But if it's a colleague who is being disrespectful to me, I will reach out to them. Somebody that I respect, and I'll have a conversation with them.
Yeah.
And it's happened before where a colleague has kind of gotten a little bit heated. And I just called them up and said, hey, so let's talk about this. I didn't mean to make you angry with my theory. Let's just talk. And I respect you. And I come from a place of respect with that. And it's really nice to do. Work it out. But if it's just some troll, don't even bother.
Yeah, it's a good tactic. You've obviously got a big Patreon account, and maybe we'll get more into that later. But I get the impression that you share some of your Patreon on the Instagram and vice versa because it's good content, right? But do you think that there's a danger that sometimes you're giving access to stuff that maybe you don't know who's watching or who's listening? For example, because it's not ring fenced, right?
Yeah, that's why I don't put it like on a direct free access to YouTube or even a Vimeo that the public could see because there's more and more do-it-yourself injections happening. So that's why I took everything I had off of Instagram and off of Patreon. Off of YouTube and put it on Patreon because now I have some control over it and I can go in and, check the credentials and, do a questionnaire and they can, write in their license and things like that. Is there somebody who could cheat the system? Yeah, probably. And if they do, at least I have done my due diligence to say that anybody who's going to be in the injector tiers has to send me their license and prove that they're actually legal.
Yeah. Fair enough. I feel like you've turned this one upside down. We went straight to business.
That's I said,
I'm all disorientated. I want to wheel us back to your early career, Julie, because, we sort of know you as super experienced and the assumption from all the injectors who follow you is that you just, you know everything. But obviously it started somewhere. So who taught you and what was your early injecting sort of career like? Did you, like all injectors, have that terror where you were too scared, or maybe in those days when we didn't even talk about VOs, you didn't have that fear? So just sort of take us 20 years back or more.
Oh boy. Yeah. So my husband is an ENT facial plastic. And he's the one that taught me Botox way before it got FDA approved. He taught me how to do that. He came from LA and came up to the small town of Redding, California, where we worked together. So he taught me when I was in nursing school about how Botox worked and how to do it. I used to follow him around and watch him because he'd put it in a vocal cord. There'd be some left. Literally the recovery room nurses were the happy nurses in that whole hospital because they had no wrinkles, right? So that's how I learned Botox. And then, when I got my nursing license and started, he taught me how to inject collagen, Cosmoderm, Cosmoplast. And then then when wrestling came out, literally the rep taught me how to inject lips and nasolabial folds with Restylane. The rep. So Alicia Merlo, thank you. My first teacher. She's fabulous. I still see her at meetings. But yeah, we had to learn things very much the hard way. I didn't really know about vascular occlusions until 2009. So that means I was literally injecting hyaluronic acid filler. Let's see, how many years is that? For 5 years. I was injecting Restylane and Juvederm Ultra. I was injecting both of those for 5 years and nobody ever talked about a vascular occlusion.
Yeah.
Nobody. We talked about infections and all of that. And my husband, in theory, he said, don't get it into a blood vessel. That's about as far, because we thought it'd be 1 in a million.
Yeah.
We really did. I mean, we did not know anything. And then I had a patient come in and showed me a picture of the tip of his nose that he had somebody put Restylane in the tip of his nose post rhinoplasty. And he showed me that the nose skin fell off.
Oh, shit.
That was the first time I ever knew that could happen. And that was in 2009. And then in 2010, I looked in the mirror when somebody was injecting me on my cheeks. I looked in the mirror and saw white blanching all over the V2 area.
Oh.
And that is the first time I saw it in real life, was in the mirror.
That's terrifying.
So yeah, it was really terrifying, but I was really lucky because my husband was down the hall and he knew what to do.
Right.
You know, he said, we have to heat this up, chew this aspirin, and on and on and on.
Right.
So he took it, you know, he got care pretty much right away.
What did it feel like? We've spoken about vascular occlusions, but I don't think we've had anyone on here that's actually had one themselves. How did it feel? Like, what was going through your mind? I mean, obviously you understood what was happening. A lot of people who are in the treatment chair that have this happen don't know what's going on. So what was the sensation, and how did you sort of deal with that?
Well, it didn't hurt. First of all, that's a misnomer. A lot of people think it always hurts, and pain is one of the vital signs. But honestly, you know, sadly, it was calcium hydroxylapatite, also known as Radius, and my injector mixed it with lidocaine with epi, right? So we would never do that today, I hope. But if it's because it got into my artery. I never felt any pain, probably because there was a ton of lidocaine in there. And secondly, it didn't hurt until it was just blanched. I mean, very blanched. And anyway, and so my first reaction was, oh my God, this is just like that patient's nose. It's blocked. My blood flow is blocked. And that was my first reaction. And then my injector said, remember, Julie, I mixed it with lido with epi. That's just the epi. So I was happy to pretty much grab her hand and walk down the road of denial with her. And I did. I let her just keep injecting. She did the right side of my face afterward. And I just let her keep injecting me. And then I noticed it went from white to a dusky blue at about a half hour later. And that's when that feeling in my stomach started happening. And I felt like I was going to throw up. And I thought, this is it. This is it. This is what happens. This is what's going on. And that's when I ran down the hall and said to my husband, is this a vascular occlusion? And he just looked at me and he goes, yes, sit down. We have work to do. And then I freaked out. Then I got scared. I was calling local plastic surgeons just to confirm. Nobody's ever seen it before. Gosh, Jory and I even flew down to LA and nobody had ever seen it before. So it was just a crazy time of nobody knowing what the heck to do about it.
Right. And then
but it all turned out fine.
Okay. So you started, so obviously, first of all, when you're talking about epi, you're talking about adrenaline, right? So just for people that aren't medical that might be listening to this.
Epinephrine. Yeah.
And then so it goes dusky blue. Jory says we've
After
got work.
white.
Yeah. So you've injected calcium hydroxyapatite, which is not dissolvable. So what actually, you started chewing aspirin, then what happened?
So he ordered me nitro paste. We didn't have it in the office. We talked to some friends who have a DME company, and they ordered nasal cannula, tank oxygen, heat, massage. Pretty much I canceled the rest of my day. Heat, massage, went home, slept with the oxygen tank, cried. It was just really scary. And then he brought me home the nitro paste from the pharmacy. And that night I put it on and it was so painful. That's the first time I felt pain. It felt like somebody took a blowtorch to my cheek. it was incredibly painful, burned so badly. So I only did that once, but I never did that again.
Yeah.
But I just, it necrosed. My skin sloughed off. I am fortunate in that, I'm a pretty healthy person who never smoked. I'm not a big drinker. So I think that just being a healthy person helped. But yeah, I see people that are using nicotine that they don't heal so well after these kind of injuries. So I do think that's something that the reason I don't have any scarring today.
So it didn't actually get unblocked. It sounds like you just had the tissue just died.
Never got unblocked.
The collaterals eventually sort of resupplied that tissue, I guess. That's terrible. I don't know if I missed in your story what area of the face and what technique was done.
Oh.
Yeah, it was, the infraorbital artery, so the whole V2 area.
Right.
It was pretty much up to my eyelid, my nose, my upper lip, my gums and my teeth were affected on the upper left-hand quadrant of my gums. And then it kind of petered down about like that. So the area was, from my lower eyelid to my upper lip, not the lip tissue, but the ergotride, nasal. Yeah.
That is
cheek.
Pretty scary. And so
anterior medial region.
How long was the healing process? And, did you have any laser treatments after?
Yeah, I did. We had 3 months of it looking like a slab of pizza on my face. So, 3 months of little kids pointing at me and saying, "What happened to your face?" That was really hard. What do you do about that? I would just tear up and try to act like I wasn't tearing up, 3 months of working and injecting people and them looking at me like, is that going to happen to me? But I did. I just went to work and told them what happened. I put it on Facebook. I put it on Real Self. I wanted people to know that this can happen. And maybe some people didn't come to me because they were scared, but that's okay. It's okay to have, I just want them to have that information. There's a lot of rumors around our small town that I had a bad batch of Botox or something. And you know how people don't know anything,
That's like the excuse for everything. Yeah. It's like a new COVID outbreak. Oh, it's caused by, it's a bad batch of Botox. It gets the blame for everything that goes wrong in the world.
Yeah.
I know. And it does so many good things for us and it gets all the blame. Yeah.
And by the way, I don't think I've ever heard of a confirmed case of a bad batch.
No.
I've heard it thrown around many, many, many times, and I've never actually heard of it actually being a thing. So,
well, it's always the counterfeit stuff, It's the counterfeit stuff that doesn't get measured, that gets pumped into somebody because they ordered it on Amazon.
Yeah.
That's the stuff that causes all the trouble.
Or people don't know how to inject properly.
Yeah. But also,
that too.
if you look into the manufacturing process of all of these toxins, forget just Botox, it's so highly regulated and so meticulously done and countless safety checks. Nothing's impossible, but I would find it hard to believe that it could happen.
Probably got more chance of winning lottery.
Yeah, well, exactly.
So tell me, Julie, this VO experience that scared the shit out of you, how did that impact you moving forward as an injector? How did it change your practice? Did it change the way you consult? Everything.
It changed everything. Honestly, I look at it now, looking back, it was a beautiful gift wrapped in a very ugly package, because so much more good has come out of that happening than bad. And I got to meet the most amazing people. I actually went to a palate resources workshop after it happened, after it healed, because I was considering quitting and going back to the OR. That was like, I was at this crossroads, right? Because I thought, I never ever want somebody to go through what I just went through. I never would want to cause that on a human being. So I was at this crossroads and I went to this palate workshop, and Steve Yolen and Glenn Vallecios were the faculty. And I stayed afterward and I said, can I talk to you about something? And I showed him pictures of my face, what happened. And I said, I'm considering quitting because look what happened to me. And he goes, Julie, I saw you inject tonight. You are so skilled and talented. Please don't quit. Please stay with this. And he goes, there's a new invention. This just came out. You can fly down to Newport Beach, shadow me for a day, and I'll show you what it is and how to use it. But I think this new invention is going to be preventing a lot of these kind of injuries. And you probably know what that invention is, right?
I'm assuming Hylenex?
No.
No? Cannula?
Yeah.
Cannula, right. Okay. Right.
So I shadowed him for a day. He showed me cannula. I saw him do nasolabial folds and lips with it. And then I kind of got my confidence back and got my groove back. And I learned the cannula. And that was super, super helpful.
Yeah. What year was that again?
I think 2011 by the time, it was either 2010 or 2011. I'm so bad at time. But my injury was February of 2010. I think when I was really scared and going through the crossroads, might have been the end of 2010, the beginning of 2011.
Yeah, I remember cannulas first come out because I'm from the UK and I was still there when they came out, and sort of a bit of a mystery. It was like, I think originally we thought it was mainly for surgeons and we didn't really understand like the use of them. And I don't even remember being trained how or when to use them. I can't remember that far back, but I do remember when they first hit the market.
Yeah, but correct me if I'm wrong, because I'm not medical, Julie, in case you didn't know. You can still get an occlusion with a cannula.
Of course.
Yeah. So, okay. So was that something that you assumed wasn't possible when you first saw the cannula being used?
Sure. Because again...
Wrong again.
Because again, man, there's so much we didn't know until we knew it, you know, and right now there's so much we don't know until we know it, right? Yeah. So we're always learning. I mean, this is such a young field of medicine.
Yeah.
And I hate the word industry too. So I don't say the industry because this is a field of medicine. We're learning it together. So the more we share, the more conversations we have, like what you guys are doing on this platform, I think it lifts us the whole field of medicine up. But yeah, we did not know. I really thought, oh, this can't get into a blood vessel because it's round and soft and, warm and fuzzy. It's not going to hurt anybody, It's going to give you a hug. It's just going to be so fabulous. And then I started hearing tales of people getting into it with a cannula. And sure, people on podium were saying, that's impossible. That's impossible. And so again, it was one of those debates that that people had, and it must be compression because a cannula cannot get into a vessel. I heard that over and over and over and over. But now that we have ultrasound, we could literally see the filler in a blood vessel. You can see, yes, you can get the cannula into a blood vessel. I've done it so many times. But there's tricks, tips. Understanding anatomy is super helpful. Understanding the patient's history. Did they have surgery? Yeah. You can be really gentle. I always say, be like a nice date. You don't just shove yourself in. You ask permission. If the tissue says no means no. See, I told you, I'm a truck driver's daughter.
There you go.
My analogies are either food or sex. That's just the way it is. If you don't like it, you can.
You reminded me of Barbara Streisand's character from Meet the Fockers.
Oh, dear God.
Was she a sex therapist or something?
I love her.
Yeah.
Oh, yeah. Oh, I love her. Yeah. I can relate to that character.
So, and just I've got the two medical people here. So in terms of the occlusion, can it sometimes be that it's not actually an occlusion, you've actually got a spasm of the vessel? And then so how do you, this is a question for both of you, maybe I'll go to Jake first. I mean, how do you identify like what's actually going on? And I guess that's maybe a rhetorical question because I guess maybe you can't. But does your treatment protocol kind of change, and how do you sort of deal with that? Yeah.
Well, shout out to Leonie Schelke. She's the one who sort of revealed all of this. Yeah. But until we had ultrasound, and, I respect everyone who has been my mentor and helped me with the occasional occlusion in the past, but I think we were just guessing.
Yeah.
We were just messing around with high LAs, using sort of first principles to sort of try and understand where the block might be. Is it in the vessel? Is it out the vessel? We didn't really know. But until you can see in there, you're just guessing. But what Leonie has sort of shown is often, and I think the case will be that you can have multiple scenarios. It's not just one thing. But sure, you can definitely have filler in a vessel. That's been shown. You can definitely have filler around a vessel that probably causes a vasospasm of that network of smaller vessels. And, you're using ultrasound, Julie, so maybe you can sort of pick up from here. But what's your sort of experience with dealing with occlusions and ultrasound?
Well, I thank God for Leonie Schelke, first of all. She was so helpful. I had this really puzzling adverse event where, of course, it was a smoker, right? My patient was a smoker, and she had a bunch of wrinkles through here. And I literally put a little strip. I was doing intradermal injections of Obella, and I did a little tiny strip of just a tiny little spider web of product. Probably got just a little bit too deep right under the skin. And the next thing I know, all hell broke loose. I mean, I was putting pressure because the blood came out when I took my needle out. I put pressure, and above my fingers, I could see blanching starting to happen and spread around the eye.
Wow.
It was calamity before my eyes from a tiny little thread. And I think it was Jillian, Murray. Yeah. Jillian Murray, who reached out to me on Instagram, and said, Julie, I think this is spasm. I think this is the choke phenomenon. And that's the first time I ever heard of it. And it makes more sense, right? If you get a little bit of HA into a blood vessel, it can cause that spasm, and that spasm can spread. And that has to be what happened because it was such a minute, tiny amount that got in there. So that opened my eyes to this. And then I just started researching this. And I think, how would you treat it differently than others? Well, I did what I always do is kind of ask the patient, where does it hurt? Where do you feel it? And go in there with hyaluronidase and inject wherever it was painful. I carpet bombed it because that's what we knew what to do back then. We just carpet bombed the area, right? I started, this is a few years ago. So it was before I had ultrasound. So I didn't have the advantage of ultrasound when this happened. But when I did get my ultrasound about 3 years ago, I was lucky enough to get on a Zoom with Leonie Schelke, learned a lot. My friend Stella, Dr. Stella, really helped out a lot with the one that I was helping with too. So I just started learning how to do that. But what do you do differently if it's a tiny amount that you suspect is spasm? It's really kind of the same thing. You want to vasodilate. Dr. Stella just wrote a paper about possible benefits of Pronox, using Pronox to vasodilate. Dr. De Lorenzi says have your patient breathe in a paper bag. And, whatever your mode is, we did laser, we did bipolar and monopolar RF to try to open up the vessels. I injected plain lidocaine with a cannula through the area to try to vasodilate. So you just got to think vasodilation. Hyaluronidase is a vasodilator as well. So whatever we did worked. She didn't lose any skin, but it's scary. And the theory is that spasm can also cause blindness. It doesn't have to be an embolism. And so, I think there's a lot of research that still needs to be done on this. So it's no longer a debate.
Yeah, just finish off. So my understanding would be that, you can obviously turn on the color Doppler with your ultrasound. I haven't had one yet, thank God, where I've had to do this, but you can obviously see where there's a change in the flow of the vessels. It gets very quiet in that area where the suspected issue is, or maybe the vasospasm. So then you can sort of trace back to the proximal vessel where it does look normal, and then sort of try and find that transition where it sort of stops. And that's where I'd be injecting my highlights. So it's almost using first principles rather than maybe actually seeing the filler to sort of identify where that choke is. So,
right.
Yeah, I don't know if that explains it or not.
Yeah, it's interesting.
No, that's really good. And I love the way Leonie calls it the quiet zone.
Yeah.
Because that's how it looks. So you can compare the other side and you can see, robust stuff happening here. Just look at the other side and it looks
quiet. Yeah.
Really suspiciously quiet. And if you see like a long tube of black, it's probably in a vessel because that's how it looks when it's in a vessel, right?
Yeah.
Or a short little tube of black. And then my approach, if I saw a tube of black that doesn't have Doppler flow, my approach would be to go behind it, maybe the facial artery, get in the lumen of that artery, get with negative pressure, look for the red flash in your hub and push, or get a butterfly, with a primed butterfly, so that you can find the lumen of that vessel and then push the hyaluronidase through the vessel. And that's been super successful on the cases that I've helped with.
Yeah.
And I've been doing that for about 3 years now, probably.
What does a typical week look like for Miss Jubilant Julie? Because you said you're not doing a lot of clinical practice with patients anymore, or you're all about education. So take us through a week. How do you sort of spend your time? How do you keep your skills up? Do you miss the patient interaction? Tell us all about it.
I still have some patients that I've kept, right?
Yeah, okay.
The ones that I just absolutely love, I will see. My weeks go by fast. Every single day is all about aesthetics, and my birthday is on Thursday. So I think on my birthday, I'm going to have a day with no screens and no aesthetics, and just take a day off. But those are rare. I usually will answer hundreds of messages a day, people needing help. I'm there on call for anybody who has an injury or an occlusion or any trouble. I try to respond to everybody that reaches out to me. So that keeps me busy. I do a bunch of videos for Patreon that are injection videos. I get ready for head and breakfast anatomy workshops that I do once a month here in my hometown. We have a little training center, and there's so much fun. There's only 12 people that come, and they sleep at our 2 houses.
Oh, so, right.
Wow.
It's kind of like
a retreat.
I don't know, it's like an anatomy nerd camp.
Yeah.
And we dissect heads at the training center, but then we go out to dinner together and we dress up, and then we might go on a hike. So those are 4-day weekends. Those are so much fun. And what else do I do? Oh, I go to my clinic in Redding, California, and hang out with my team. I have a team of 8 amazing injectors, and I teach them. I assist them, and sometimes they teach me too. Hey, look at, I'm doing this, and look at how good this looks. Yeah, we just spend time together learning and teaching. So it's just I feel like I have a fulfilled life. I spend a lot of time with my husband and my dogs. My kids when they're home from college. And my daughter lives up the road with 2 little grandkids that I get to squeeze. So I'm just having fun with grandmotherhood. I even have a granddaughter in Japan that I just adore. So yeah, life is good, but it's busy. It's busy.
That sounds fun. I mean, how do you keep up with all the content creation? Because, we're content creators as well in a different way, and we're running our Patreon, maybe not to the level of yours yet, but it's a constant battle. So do you actually schedule it? Do you have a morning of, these are the days that I'm videoing, or is it just a bit more haphazard?
I'm a Virgo Libra, so I want to be organized and I want to have my stuff together, but I don't. Right. It's organized chaos is what it is. I don't think I posted in a week. Today's Talks Tip Tuesday, so I got to think of something to talk about talks. I think I'm going to do Metellus after we get off the phone here. But It's always a little gnaw in the back of my head. You got to do a post. I don't hire it out because I don't think it would be as authentic as to teach aesthetics with somebody else driving it. I have my team do my business Instagram, but yeah, I think I need to be more consistent for sure. I can't believe the growth I've had with not being consistent, but I think that people are just hungry to learn. And I think more and more patients are starting to follow some of us injectors now. So it used to be just injectors followed all of us. Now I think patients want to know. And that's why I think this podcast you're doing is incredible for medical and non-medical alike.
Yeah.
And I think it's cool that you're not medical because, people want to know this and nobody's talking about it. And I think it's incredible.
We've also got the reality that these are businesses at the end of the day too. And so there's a lot of people with an amazing clinical background and education, but when it comes to running their business, HR issues, contracts, medico-legal issues, analysing their numbers, like a lot of people don't have a lot of training in that. So I guess that's kind of how Jake and I sort of bounce off each other. Like I've owned businesses in this space for a long time, so I kind of get the medical side to as much as someone who's a lay person can, but it's nice to be able to have those mixed conversations. But getting back to you again, enough about me. What is it that drives you every day? Because it seems like you've achieved everything, right? You've got 300,000 shoes, you've got houses, you've got grandkids, you've had the occlusions, you've gotten over them. Everyone, you've got this huge following. So what drives you, and what are your goals now? Like, what are you trying to achieve?
Well, I just got back from the inner circle. I've done that 2 years in a row now. And the big focus of that is what's your purpose? What's your why? And what I've found out, because I've thought about this a lot, like, why am I addicted to this field of medicine? Why am I so gung-ho over it? It's because my why is connecting with people and making the world a more beautiful place, right? So what is beauty? Well, to me, if you are your true self and you're connecting with people, goodness will flow out of you and it will ripple and affect other people. Like, try going to a grocery store and not smiling the whole time. People won't smile at you, but try going in with a smile. Everybody you pass can smile back to you. I would imagine. So we need to smile more, bark less. I just connect with people and share your joy. And that does make the world a beautiful place. Right. That's just how I feel. So that's my purpose. Whether I'm teaching or I'm, injecting somebody, it's not just about their beauty. It's about how they feel. They're going to feel cared for because I do care, and they're going to feel confident if I can restore something that's changed over the years, And I get it, man. I'm turning 56 on Thursday. It is, there's a lot of changes that happened, especially to postmenopausal women. And I want to help them have that confidence that I have. I want them to feel beautiful in their own skin and beautiful around their friends and family. And that's easy to do if you care and if you connect with them.
It's interesting you sort of raised that postmenopausal situation. I think we were talking to one of our other guests a couple of weeks ago from the UK, and he runs a GP clinic that does a lot of postmenopausal stuff. But I can't obviously speak to this because I'm not a female, but from what I've heard is that there comes a point where, and I guess this happens to men as well, but particularly women, is that they start to feel invisible in the world. Like, people stop noticing them, stop talking to them, stop engaging. And it seems to be around that kind of age, that transitionary period where particularly women go through that really, I guess it might be confrontational and scary. Is that something that you kind of experience and tap into?
100%. Yeah. What happens, as the aging process happens with our skin, bone, muscle, fat, those four things just start to be reabsorbed and fall. And that leaves us with a very bitter look, angry look on our face at rest when we're only just minding our business. And it's that biofeedback that we talked about when you're in the grocery store and you're not smiling. You're just minding your own business, looking for your eggs, right? People are going to look at an angry expression that's not your fault. it's just because you're 55. They're going to look at that and maybe not smile, just keep on walking and look for their milk, that. But you see somebody with no shadows, no support, no falling, who has a little bit of help, maybe longer eyelashes from their, eyelash medication, who knows, hair that's vibrant, then they're going to see a resting pleasant face instead of a resting bitch face. And the world smiles at a resting pleasant face. The world smiles at another smile. It's contagious. Yeah. So I think if we can get baseline just taken away, that what gravity and bone resorption and deep fat pad resorption is doing, we can do a lot for these people. And I wish it wasn't so expensive, because I think everybody could benefit from this. Mm-hmm. But in the United States, it's extremely expensive. Yeah. So I try to be budget conscious, budget minded, work on it little by little. But I think the world, if aesthetics done nicely and done beautifully, artistically, can look really natural. I've never had anybody guess my age, and I think that's great. I'm not ashamed of it, but I just wish everybody had the advantages that we all have.
Well, firstly, happy birthday. We didn't say happy birthday. So happy birthday, coming. But I loved what you said. That really gets to the crux of how I often end up in my consultations with people of that age group, because they come burdened with all sorts of taboo, guilt, judgment for maybe exploring these things. And I really try to untangle that and disassociate it from them, because you said yourself, your face is the passport to the world, and it's not your fault if it changes. It's life, it's gravity, it's age, and it's what kind of happens with biology. But if you could do something about it that still looks good and natural, I think that's something that most people would aspire to if it was possible. Yeah. And yet it just gets tangled up in marketing and bullshit and judgment and husband saying this and friends saying that, and it puts people off. The noise puts people off, but the result, if done well, is always positive. Yeah.
Well, when you think about it, like from an evolutionary biology perspective, like Mother Nature doesn't care about us once we've been old enough to reproduce. Like when you look at like how long our teeth last in our mouth, right? So all of these messages that get sent in our body for regeneration and sort of they're all kind of down-regulated once you've gone past that child, reproduction age. So we're not, let's say these things aren't our faults, because we're not really supposed to be alive, to be honest with you. And so that's just the reality of the situation.
Yeah, we weren't living to 80 as cavemen.
Yeah.
So
we're made to reproduce, and that's it.
Yeah, you'd kick a rock and get an infection and die like that. Yeah, that's basically what.
Well, what are your thoughts on regenerative treatments that are sort of coming in to augment what we're already doing? Because let's be honest, we're sort of papering over the cracks here.
Oh my God, that's my newest obsession. Oh God, how much time do we have more? I mean, at Inner Circle, Nicola Conlon talked. She's so brilliant. She's just brilliant. Really inspiring about how the cell ages. And just like you said, we're meant to reproduce, and then that's it, right? So our everything just sort of goes down very rapidly. Our NAD plus and all of this. So I think that this is, I don't know, we might live to be 200 if they hurry up, because there's some new meds coming up. Yeah. And I could do that. I could be 200 as long as I don't have bursitis or something. I can't walk around. That would be terrible. But yeah, as long as our brains are, sharp, it'd be fun to live a little longer. But yeah, I think that we're at the infant stage of this regenerative medicine. I think it's going to explode. It's exciting, and I'm spending my time reading and studying more about that. Picking her brain, taking her supplements, the NAD plus supplements, and we'll see. Doing hormone bioidenticals. I don't know, lots of good skincare, and just trying to hope until the anti-aging pills come out. Then I'll be all about that. I'll stand in the corner and literally do anything anybody asks me to if I can't afford it, because I'll wash cars. I'll vacuum out your house. Just give you those pills. No, but I think it's exciting. I think we're in the beginning of it. It's going to explode. It's going to be great.
You've just done a great advert for us. We've partnered with Nicola before. She's been on the podcast, and
you did?
Yeah, if you guys are genuinely interested who are listening, you can actually try this stuff, and we've got a discount code. So just go to insideaesthetics.com/offers. And, all of our offers are there, including Nuchido, which is the name of the supplement.
I'm up to my 3rd bottle.
Are you?
Yeah.
Right. Okay. Well, there we are. I need to order some more.
She needs an ad that says, like, from Cheetos to new Cheeto.
Yeah, exactly.
Yeah, 100%.
Right? You're welcome, Nicola.
I forgot to ask you.
That's how to go to healthy to young.
Yeah, exactly.
I forgot to ask right at the start. So I know you said your husband trained you in Botox, and I think you said Steve Yolen, who I think is Nicola's medical director. He taught you some stuff. But who's been your biggest inspiration, or who's a continuing mentor, or who do you think's the greatest injector?
That's so loaded.
I know.
Steve Yolen has been the most impactful in my career. I think I about died the day he said, "I'm suggesting you to work with palate with me, to be a teacher with me," and that really took my breath away, and I cried with joy. He's the guy. He's an unsung hero. He doesn't even have it. Social media, one of the nicest people in this world, and an angel on this earth. And my husband, who's another angel on this earth. That guy, he's just amazing. So he never judges. He's always ready to teach. He's brilliant. Those two men are my favorite people. And as far as colleagues, there's so many. I mean, there's so much talent. How do you even say, if I say 5 people, I would forget 95 people. So I'm not going to take the bait.
Damn.
but Steve Yolen for sure, good human being and a really good friend. And he's probably one of the big reasons I didn't go back to the OR, and I'm very forever grateful for that.
Okay, I think we have to get Steve on. I've never met him. I don't know too much about him because, like you said, there's not much out there. But there's twice in a few episodes that he's come up.
Well, we've been speaking about this because we had Michael Caine on about 6 months ago. 6 months?
Probably longer now, yeah.
And we've had people like Arthur Swift, who's obviously got a big name, like Gene Carruthers. So all these people that were like the godfathers and godmothers of the industry, and particularly people, as you said, like Steve, who don't have a social media profile. If you were to sort of randomly survey 100 injectors who are in their 30s, they probably have no idea who these people are. Some of them, or particularly like people like Steve. So
and
we should.
Jean Carruthers. Oh my God! When I met her, I was such a fangirl. I was like, oh my God! And it was on a Zoom that I met her.
Yeah.
I'm like Twitter pated for Jean Carruthers. Like, I can't believe this is real.
It's pretty special, right? The actual person who started all this is giving you their time. It's pretty cool.
Yeah.
I know.
So we should get someone like pick Steve on who hasn't have a big profile and remind the world who they are or introduce them to the world.
Yeah, we'd love to.
Yes, and oh my God, Jill Jones. That's another one. Grandmother of training. I mean, she had the very first training institute that I've ever gone to. Jill Jones is amazing. Incredible pioneer. There's so many.
Jill.
Connie Brennan.
You're going to have to introduce us to these
people.
Jill?
No, we need your black book of all these people.
Oh, yeah. I mean, there's so many legacies out there that people don't know. And I wish they did, because they have so much to teach, and they're passionate about it. M.K. Maloney. I could go on and on and on. But yeah.
Well, we should do the.
Not everybody spends time on social media, and they're probably more mentally healthy than I am. And those of us who just just spend so much time on it, but they're amazing people.
Yeah, look, David and I were talking just about a week ago, and you mentioned Michael Caine and a few others, but we actually want to have an actual focus on
the Pioneer series or something like that.
Pioneer series, Legacy series, because many of these people are close to retirement, and once they're gone, they're gone. We'll never get those stories back. So if we can capture some of those chats and those real beginnings, way before you, Julie, back into the early 90s and further back.
Yeah.
That would be cool.
Yeah. So if you can hook us up with any of these people, do some intros because we'd like to get them out there.
I'll do it. I'll do it. I'll connect you.
Now, talking about training and teaching, you mentioned that you are a trainer for Allergan Medical Institute. I think you said Galderma, you do palate. So what does that look like? Like, what's your commitment time-wise? What do you actually do with these companies? Do you still enjoy it? Because, I know it can be grueling and lots of travel involved, and obviously you're constrained in certain ways by pharma as well. So just give us a flavor of how you feel about all of that.
Yeah. Well, I started doing the training, in-office trainings back in 2012. And there wasn't very many Allergan trainers back then. So I feel like it started out kind of slow, then it quickly got to a lot. So I was spending most of my time away from home, and my boys were young. They were 10 and 12, I think, or 12 and 14. 12 and 14. And it was really hard to be away from them so much, but I did it. I wanted to make a difference. I was driven by making a difference and making the space and newer injectors more safe. Because of what happened in 2010, I was driven to have people be as safe as possible. So I went all over the place in small offices and taught, right? And my husband wasn't happy about it. My children weren't happy about it. Even today, they're 21 and 23 now. And they're like, yeah, Mom, Dad was always home and you were never home, And I thought, wait, before you were 12 and 14, I was home all the time. That's a lot of years to be home, so it's hard, I think, for trainers. They don't realize how much you're going to, to get a name for yourself. You really work hard, just like you said, and you make more money staying at home in your office than you do out there. So you can't do it for the money.
Yes.
You cannot. Say you make $2,000-$3,000 on a training, you can make that in your office and pay your staff, in just a hour or 2, maybe 3 hours. So it's not the money that trainers do it for. I think you've got to have that passion to drive to do it. So I hardly do those anymore, just because I don't have the time to do those anymore. But I'll do like the Allergan has a master expert series. I get to work with a colleague, and together we get to teach people that are more advanced, and it's really, really fun. And then for Galderma, I love going to ad boards. I love going to offices that are local that I don't have to drive a long ways to. So I'm going to be, teaching locally. Or if I happen to be at a conference, I will reach out to a rep and say, hey, I'm in town for, I'm in Dallas for this conference. And if you need me, just, hook me up the day before, the day after the conference. So I'll do that. But I don't just go out all over the place, flying all over the place anymore like I used to.
Yeah.
Oh, and I just love it. I just love teaching, whether it's a conference or whatever. If you ask, I'll say yes, chances are.
What kind of stuff do you do with the advanced injectors? Is it hands-on injecting? Is it theory or both? Or
the one I just mentioned, the Allergan's Master Expert Series, it is a lot of didactic for everybody that talks about more advanced teaching, more advanced concepts, more advanced anatomy, and very, very detailed hands-on. So it's kind of like a Montessori project where everybody gets hands-on and understands. And then, I will inject to demonstrate, and then there'll be somebody coming up on stage that is learning that other people will watch. So both me injecting and the person, and then the co-faculty is usually a physician who will do the same thing. So it's usually a physician and a nurse practitioner or a PA or a nurse. And they're so much fun. They really are. And it's just sort of a full day. And while I'm there, I might do, go to an office or two and have more fun in there. I do like the small settings of being in a medical office, one-on-one.
something that comes up regularly, and we often ask our experienced injectors on these sorts of episodes this question, and then I'm going to add a second question. So you obviously train a lot of newbies as well through your Patreon and maybe Palette, I don't know. What do you think leads to competence? Like at what point is someone ready to take the training wheels off and go out on their own? Like how do you judge that?
Yeah, like when I train somebody for my office, I like to have them shadow me for 3 months and then me shadowing them for 3 months.
Right.
You can see in a consultation so much good or bad happening. So first of all, I'm looking at connection. Can they connect with the patient? Because if they can't connect and they don't have the personality skills, I'd rather let them go right away.
But what do you actually say to those people? Because it's a crushing conversation, isn't it?
It is. And I've had to say it before in the past. I'll say, hey, I really want you to try really hard to connect with every single patient. And some patients won't be for you, and that's fine. But I want to see you have a little more joy in your eyes and a smile on your face, a little, compassionate listening skills. And if I'm not seeing that, then I just let them go because they are the face of your business. So I want people to basically have my morals, my values, my ethics, and if they don't fit that culture, then they're going. So then, if they have that and they have the good consultation skills and they really are connecting with every patient, I'm going to next watch for their hands and their knowledge. So I will test them. Say, okay, so what muscle are you targeting there? Where's the origin? Where is it inserting into the skin? If they're doing filler, hey, so what arteries are you around right now? What are you being careful for? What layer are you in right now? Things like that. And of course, not with paying patients. I wouldn't be quizzing them because that wouldn't feel good as a patient.
Yeah.
But, in the training phase with people volunteering to be, training person, I think we really need to pay attention to their skill level, their knowledge level, because it's a very cumulative. Learning is cumulative. I'd rather they get the basics and then build on the basics rather than just throwing everything at them and saying, all right, tear trough room 5, go for it.
Yeah. Yeah,
Simples.
I agree. I just don't.
You got it.
I just don't think us injectors who are teaching have the bandwidth to do that for so many people. It's a lot of time and effort and hand holding and feedback, and I don't know how we scale that.
I talk to a lot of people.
I don't either. That's why I haven't scaled.
Yeah. Well, like a lot of people that I talk to, conversations will come up around taking on new injectors and what's their journey going to look like. And there's a lot of commercial discussions, but inevitably we always end up talking about, well, how are you going to upskill this person? And there seems to be, and this is not for me to sort of say whether it's right or whether it's wrong, it's just an observation, that it seems like this is like a specialty unto itself. Like just if you went and became a GP or a plastic surgeon or an ENT or whatever, that's generally someone who's already got a certain degree of training, like a medical qualification, who then goes on to do a specialty. But we're trying to teach people how to do what we call the basics, lips, cheeks and tox, in like a weekend or a week or two. And for someone that's an outsider who's not sort of doing these treatments, that seems like a very ambitious goal. And I often wonder, are we actually setting ourselves up to fail? Because I guess you guys have learnt over, Jake's been doing this for 11 years. I'm not sure how long you've been doing it.
Mine's 16.
Yeah, 16. Oh, wow.
Nearly.
Jeez, you old bastard.
Yeah, I know.
I often wonder, are we now that we know more, we didn't know what we didn't know 10, 15, 20 years ago. We know now how much is involved, how much can go wrong. We've got different cannulas, different planes that we're injecting in, like different products to choose from. Ultrasound. It's a lot more nuanced. Like the art form and the specialty, inverted commas, is becoming more detailed and more involved every year that goes by. So I often wonder, why are we trying to force people to learn all this information so quickly? Why aren't we saying to someone, you're doing tox for 12 months. Get really good at
Yeah.
Botox. Understand your facial anatomy. Get really good at getting people results that they're not getting anywhere else. Understand the elevator-depressor relationship. Understand how you can change the shape of someone's face rather than just chasing lines. If you can do Botox or any toxin better than what they're getting elsewhere and really have that attention to detail, those patients are going to be loyal. It doesn't matter you can't do, like a jawline yet, or you're not going to do a nose, or you're not going to be doing all these other sort of advanced treatments. And it's not really,
Oh, God,
I just wonder,
now.
is that, I mean, am I crazy to think that we're just fast rolling people for the sake of it because we don't it's either like we're undervaluing or not appreciating as an industry how complicated it is what we're doing. And do we need to take a step back and go, this is like a 3 or 4 year journey and you're not going to touch a filler for 2 years or 12 months. So I'd be curious to know, well, Julie first and maybe Jake, what your thoughts are on that from just someone that's an outsider looking in going, this seems pretty crazy.
Yeah, I think I agree with your sentiment. And I think too that if you hire people full time, you're going to be at an advantage. If they have another side hustle that they're doing, or they want this aesthetic medicine to be their side hustle, you're going to have a lot more trouble getting them up to speed in any time. So I like to hire people that have never done it in their life. I hire bubbly personalities and serious, smart people. So I try to look for people who have a passion, who have never done it before, but they want to, and they have this drive. Because when I've tried to train people from not from scratch, they bring all their bad habits with them from the last place they were with, and that's not good, right? So, and you also don't want to train people that are going to leave you and go start their own place. That's a whole other big problem, right? It's so expensive to train somebody. So say somebody did Botox for a year, they're really skilled at it. They want to learn fillers. Well, somebody might be super skilled at Botox in 1 or 2 months because they're watching a whole bunch of Patreons and they're really diving into it and they just immerse themselves and now they're ready. So I don't think you can put a solid timeline on anybody's skills. Some people it'll be 2 months. Some people will be, 2 years. Would I fire that person that's slowly picking up Botox? No, as long as she or he is connecting with the patients and doing a dang good job with the toxin, then fine, they could do it for 2 years. Mm-hmm. But usually they'll grab it quicker because that's all they're doing. I do have some people that have other jobs. I wish they didn't, because I think full time is when you're going to shine.
Yeah.
Your skills are going to shine. When this is all you do and all you learn about, it's just better.
Yeah.
Yeah, I agree with that. And just to shout out one of our patrons, because we put out that, you're going to be coming on and do you have any questions for Julie? And she sort of, it's not really a question as such, but she sort of said, her name is Jennifer O'Brien. I think she's based in the States. And she was listening to our episode with Nicola, and we had a similar chat with Nicola. And I think Jennifer's, less experienced. She's been injecting for a few years, and she wondered whether sometimes there's an assumption that you have to have numerous years of experience before you can be good. Because she has said, she's an example of where she threw herself into it. She essentially got a lot of different education, and she feels relatively comfortable, even though it's only been a few years. So I think, like you said, Julie, some people are just faster learners, or they just really dedicate their limited time to it, and they just pick it up quicker. But, having trained lots of people, and you've trained more people than me, Julie, I do think as a general rule, the longer you've been injecting, the wiser you become, because you just know which battles to pick, and sometimes you just smell something that doesn't feel right. You can't really explain it, but you just know to back off. And you only learn that through saying no multiple times and occasionally saying yes in your earlier years to learn those lessons. Whereas with the newer injectors, you have this Dunning-Kruger effect where they think that they're confident and then they realize that actually there's a lot more to learn. So I don't want Jennifer to think I'm not agreeing with what she's saying, but I'm just saying it kind of depends.
And there's also the concept of, sorry, Julie, do you want to jump in or come in after you?
I just want to say if Jennifer lives in the Southern Oregon or Northern California region, I want her to call me because I would love to hire somebody like that. Because she sounds totally into it. She sounds like somebody I would want to hire, right? And I applaud her for diving in like that and being and wanting to get to that expert level. But I think she needs to remember, and all of us need to remember, how did we get to where we are, right, Jake? We got to where we are because we made mistakes.
Yep.
We have made many mistakes. And how many brows did we drop? How many people walked out looking like Angry Birds the first 10 years,
Jack
right?
Nicholson, yeah.
I mean, yes. I mean, that's why we know what we're doing, because we've done the things.
Yeah.
So, it's just like, it's like parenting. You make mistakes and you try to make your kids not make them.
Yeah.
So when we're training these people, they're going to make mistakes, and that's fine. So don't get in this whole huff. Oh, no, new people make a lot of mistakes. Well, so do the old people.
Yeah.
We made plenty of them, and there's no shame in that. As long as you connect with your patient, they'll forgive you. You'll do better next time. So I like to applaud people like her that are really in it, that want to accelerate it. I don't think there's anything wrong with that. And the same thing, people degree shame. Don't degree shame people. If it's legal for somebody to inject in that state, then guess what? Don't shame them. They're doing what they are legally authorized to do in that state. You know. So I see that happen a lot, and it breaks my heart. I know some dang good injectors who are, associate degree nurses, or, even MAs in some states, estheticians. There's 50 states here, and they're all wildly different. And I just say, hey, if you're legal to inject wherever you're living in the world, then you're welcome to let me to be a part of your path. But I love that drive and ambition, and I applaud her for that.
Yeah. Well, there you go, Jen. If you're living in Northern Cali
we got
or
your
Southern
job.
Oregon, you got a job and you're welcome. There you go. But I do think as well that, even if you're super enthusiastic and you're doing heaps of a particular task, there is still a certain amount of time that needs to pass for that to sink into your brain. Like you fill a sink full of water. The water can only get through that pipe at a certain speed. And so I've experienced this myself with learning skills, or you'll practice, and one day it just sort of sinks in. But you just have to wait for it to sort of filter through your psyche and somehow, solidify itself in your mind. Yeah.
And not to be crass, but some people have a bigger pipe than others.
Oh yes, bigger pipes. We've gone back there, have we?
We're going to change your name to. We're going to change your name.
He started it.
Yeah, we're going to change your name to Dirty Julie. There you go.
Why do you think I'm always so happy?
Yeah.
I'm moving on.
Jake's blushing.
Yeah, we had another. I think it was a question, from Natalie Smith. I think Natalie is based. I don't want to get this wrong, Natalie.
What's the country code?
I'm trying to work it out. Can't find it. This is her business account. Anyway, Natalie, thank you for your contribution. She basically said that, Julie, you've highlighted, I think somewhere, must be in your social media, that there's a bit of inequity in pay for trainers, particularly females and maybe nurses. So how do you have that discussion with conferences or training companies? And what's your advice to maybe less experienced trainers who sort of feel a little bit like, they don't know what to say or how to counter that if they feel like they're being undervalued?
Yeah, I have not been good at this. It just hit me a couple of years ago. I was at a conference, basically doing the same thing, exact same roles, exact same responsibilities as a physician faculty, and I learned that I was paid half of what the physician was, and I approached one of the heads. I'm not going to say the company or the names, but I approached one of the heads of the company, very upper up, and I said to them, do you think it's fair for somebody to do the exact same things with the exact same responsibilities and the exact same amount of time to be paid half of the other person? And he goes, I don't think it's fair. And I said, so how can we change this? And he said, that's a good question. It's the way it's always been. Doctors always get paid more than nurses for teaching. But you're right. It's not fair. You and the other nurses, nurse practitioners, PAs are doing the exact same thing. Maybe a nurse can't diagnose and treat, but a PA can, an NP can. So I think at least people at the same responsibility level should be paid the same. In our country, the United States, it's shameful that 50% of physicians are not women yet. We're in most developed countries, 50% of the doctors are women. In the United States, it's 37%. I think we got some work to do with equality. I don't think we're treated the same as we are in other countries. Japan's like 22% that our physicians are women. And I think that's incredibly shameful. I have a granddaughter in Japan. I hope it changes by the time she becomes a woman. But I don't like it. It does. It's a thorn in my, side. I can't handle it. So I think if you're new and you're kind of starting to get your chops, you're just grateful to be asked to be a trainer. You're just grateful. And you're probably not going to have that courage to say anything. It's going to be up to people like me and my colleagues who have been at it a long time to advocate for you. And that's what I plan to do. I plan to advocate, talk to the company heads. I don't have that fear anymore of they won't like me. They won't ask me to train because basically I feel like I don't need to train for them. I just want to train I can train for myself. Yeah. So I don't have that fear anymore. So talking to that executive gave me kind of some headwinds because he agreed, at least he said he agreed, but nothing has changed in the last 2 years.
Mm. Are you able to say which conference that was or not?
No.
Fair enough.
No, I am in a shoe closet, but I don't have a few margaritas. I can't tell you.
Damn. We'll have to get you on a 2-hour Instagram
totally
live.
Sober.
Yeah, we'll get you on a 2-hour Instagram live and we'll name and shame everyone. Yes.
I'll never work in this country again.
Yeah.
No, it doesn't matter. It doesn't matter, right? The companies are great. And, look at some of the companies with female leadership. Allergan and Galderma both have amazing female leaders. So they care about diversity. They care about inequality. They do care. It's just policy that needs to change. It's not like there's evil companies, putting women down. It's policy. It's like, this is what's always been done. Yeah. So this is hard to change, Julie. This is a hard one to change. And I'm like, no, it's not hard. When you do the contracts, guess what? Oh, they're doing the same role. Master Expert Series, for example, we're doing the same thing. Yeah. Straight across the board, it should be the same. So I think when I re-up my contracts for any of these companies and speaking engagements and whatnot, advisory boards, I'm going to ask the question: am I getting paid the same as everybody involved in this project with the same responsibilities?
Yeah.
And if the answer is no, I'll say, this needs to change. And until it does, no, thank you.
Yeah, I think that's fair.
Yeah.
It gets tricky because in some countries you just don't have nurse injectors. And so even access to the conference, forget speaking and pay, it's limited or I don't know, it gets a bit difficult. And I guess you just have to respect that local culture. I mean, we can't change the world in a day. But if you're going to ask someone to speak, I find that a bit bizarre that you wouldn't have parity for everyone. It's the same thing, right? And they're leveraging your skill, your knowledge. So why not pay that person?
And also your reputation.
Yeah.
Yeah.
Yeah. And it's not experience either because, a doctor is very often busy being a doctor, saving lives, taking skin cancers off, like my husband cutting cancers out of a neck. They don't have as much time as somebody dedicated to the field has. And we have a lot of experience to share. We have a lot to teach, and we should be paid accordingly. I really believe that strongly.
Yeah.
Oh, and one more thing. I have one more thing to say because you brought it up. Conferences that will let nurses attend and PAs attend, but they will not let us on the podium.
Oh, that's ridiculous. Yeah.
I will not go to. I have boycotted them. I don't think that's right. And yeah, I want no part of that. And they need to change. They need to ask experienced people something to teach up onto the podium.
I was going to say, I know this is a slightly longer Injector Diaries episode, but I've just got a few more questions about your Patreon because we need to learn. You can teach us something, Julie. So we actually find, and maybe we're wrong, but it's a very American-centric sort of platform. So if you ask an American injector about a Patreon, they immediately know what it is, they know how it works, and they just get it. But when we talk to people about Patreon, they're like, what's Patreon? We don't understand it. So do you have trouble explaining it to people?
Oh, yeah. Like Keith Marcus the other day, he goes, is that like OnlyFans for injectors?
Yeah, kind of.
Like, oh my God. Keith. Yeah. A lot of people still don't know, and that's fine. I think that we need to kind of like talk about it more, put it on our Instagram more. So, like I'll label some of it that I'm taking off of a Patreon reel so that they can see on Instagram that this is a snippet of a video I did on Patreon. So if they have, it kind of whets their appetite to say, oh, I want to learn more about that.
Yeah.
Not just the superficial stuff. So I want to dive deep into what she's talking about. And then I'll have a link so they can go straight into the Patreon. And I think it's important that we are clear that not just anybody can learn how to do this stuff, that you have to be legal and qualified so that people aren't out there hurting themselves. But yeah, I think you will agree with that. I don't know if it's like with you where you guys are, but I think you can, get counterfeit product anywhere shipped to your doorstep across the world. And it's very sad.
Yeah, it's crazy. We're quite hot on that. So we have an intake form. So people have to fill that out and they can't get access to our WhatsApp groups until we've identified, you're that person and we've got your license number. So we try our best. It's not a perfect system. I wish there were things that we could do with our Patreon to make it more seamless, but it is what it is. How many subscribers do you have to yours now?
About 2,600.
That's pretty good.
Massive,
yeah, that's huge.
About 10 times us.
So, for those people who are listening who don't know what it is, how do you describe in one or two sentences, what is Patreon?
It is on-demand videos that they could watch anytime. I mean, some people say that their husband hates the sound of my voice because it means they're not going to get any. So they watch it in bed. I'm like, don't watch me in bed. I'm like, stop it. Give them some love. But they're on demand. Right. And my videos are about 20 minutes and probably their husband's love's about the same time. So spend your time with your husband for those 20 minutes. But no, you can watch them anytime on demand. You can search for, a subject you want to learn about. And I think just give yourself some time to build it up because I started in 2019, right before the pandemic is when I started mine. In 2019, I started just with a couple of people and I just really got to know them. And it's kind of cool because you get to know people through there that you see at conferences and get to hug, get to know them better. And then sometimes, I don't know, it's just a really cool community where everybody's nice. Nobody is mean to each other there. It's really, really, it's not only fans. It's a serious learning platform.
Yeah, no, we agree.
But I think it's so worth it. I think that just be patient with it and put it on Instagram as much as you can that you have Patreon. Now, I just learned that you guys had one just recently, so I'm going to be subscribing to yours too.
Awesome. Thank you.
I do. I subscribe to all my friends and colleagues, and I like to support them, and we need to support each other. I subscribe to several, and I wish I had more time to watch them, but
Yeah, well, I'm a subscriber
my husband
to
would
yours.
not be happy.
I love yours, Julie. It's really good. And you taught me a lot about how to run it and what sort of stuff can go on there. So thank you.
Sure.
we tend to end these episodes with some similar repeating questions, and these are rapid fire, so just 1 or 2 word answers only, okay? I think I know your answer to some of these already anyway. What's your favorite?
Penis.
Sex. Dirty. OnlyFans. No.
Oh, just kidding.
Okay, what is your number one toxin and why?
Botox, because I know it best and I can predict it.
Cool.
Same question again, but for filler. And then I guess just to sort of expand on the question, if you only had one filler that you could use forever, what would be the one you'd choose? I guess probably
Voluma.
Okay. Easy.
Okay.
Voluma. It lasts a long time, and again, I know it. I know it well.
Mm-hmm.
Fair. What's your favorite cannula make and size and why?
Probably the TSK Steriglide. I hate that the syringes of Allergan are wildly tighter and different than the syringes of all the other fillers. So I use a lot of Steriglide because they make them directly for Allergan, and you could use those on other ones. So, but they're like $11 a piece.
I know.
Yes.
Expensive.
So I recently found one that's like $1.50 a piece that I use in my cadaver workshops.
Wow.
And I just wish that we had those available in the States.
What are they called? Do you know?
Yeah, I use the Yastrid.
Yastrid. That's new for us. Yeah.
I don't use I'm afraid to use them on a live person just because they came from China. But for the cadaver workshops, heck yeah. For cadavers, I hate using something that's $11.
Yeah.
So I ordered a bunch of those for the cadaver workshops. But I think that there's other brands that can make it a very good product, like the Yastrids. Very good product that is perfectly fine and acceptable. It's just that what we have in the States are wildly expensive. But I think Dermasculpt is great. TSK is great. But I want a large bore and a soft top. And I do like the ones with the marking on them, especially doing tear troughs, so I can gauge it and go in and know exactly how far it is for teaching that. So
that was a long one word, wasn't
it? No, not one word. Sorry, that wasn't rapid fire at all. That was slow fire.
Slow burn. Aspiration, yes or no?
Yeah, absolutely.
Okay.
Cool.
Yes.
That was very confident.
Yes. It was a confident yes.
Okay, last question.
That's easy.
What's been your most, influential book, course, or other educational offering that has influenced your practice the most? Could be a conference.
I would say...
Could be a podcast.
The little tiny palette workshops that I did early on. And Jill Jones, Jill Jones's workshops and palette workshops, because those are just a few people in the room and they give you all this attention and hands-on. They totally shaped my career. I think Jill Jones's courses and palette resources courses shaped my career 100% hands down. Conferences are great, but when you're in a small group of 10 people or less, you're going to learn it. They inspired me to do our head and breakfast cadaver courses here, because people learn it, people connect, and they make friendships. And I've made friends with people at these conferences, these little ones. So I'd say if you have an opportunity to get in wherever you are in the world, to get in a small hands-on workshop, that's the gravy. That's where you're going to connect, you're going to learn, and it's going to fire you up.
Yeah, 100%. I couldn't agree more.
Well, that was fascinating, entertaining.
Always.
Slightly inappropriate, but also appropriate at the same time.
No, I love
but you already
that,
knew that about me because I'm being myself.
Exactly.
It was as fun as I imagined it was going to be. I try and remember when I first reached out to you, I reckon it was closer to 2 years ago, and we've just been busy. And anyway, here we are. Yeah. We got it sorted.
Yeah, I get messages from a lot of people. I didn't know who you were, and I kind of ignored it a little bit because I was like, oh yeah, just another.
She makes me feel so special.
And then somebody said your name and Inside Aesthetics, and I was like, what? They're legit? Oh, I better go back and look at my messages.
Not just random spammers.
Good to know how I come across. Yeah.
Oh, yeah. A colleague said they were interviewing with you or doing something with you. And I was like, I wonder why he hasn't asked me. And then I went back and I'm like, wait a minute. I think he did reach out to me. And I went back and looked. I'm like, oh crap, I feel like an idiot.
It's all good. We got there. Well, thank you for your time. What the people don't know is we're going to record another one straight after this. So we're going to showcase you twice in the next couple of weeks.
Yeah, exciting. Double dose.
So go and have a break, and we will see you on the next episode.
And thanks for taking the time and being so candid and honest and funny. It was good. Thank you.
Thank you, Julie. Take care of yourself.
Thank you. I had fun.
Bye-bye.
Okay, bye.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our IA Patreon platform for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.